Well, hello everybody and welcome to The Bridge. I'm WSAV's Natalie Hendricks. As you know, we've taken The Bridge from the studio to the streets. You know, believe it or not, every year millions of people develop cataracts. And it's true, while cataracts are a natural part of aging, well, there's a lot of misinformation about cataracts out there. Cataracts are not something that grow over your eye. They are a natural progression of your internal lens that starts to turn yellow. And nearly everyone will develop a cataract as they age. So what can you do to take care of your eyes? A lot of things, actually, and we talked to an expert who has great advice. Dr. Bonnie Henderson has literally written the book on what to expect when you have cataract surgery. But before she operates on any patient, she discusses the symptoms of cataracts and how they can negatively impact lives.
One of the common symptoms is difficulty with nighttime driving. A lot of patients say that the glare from the headlights become very annoying. And in fact, a patient of mine came in recently, and I've been following him for these cataracts, and he used to say that he was having more and more trouble. So when I asked him about it, he said, oh, well, don't worry, I stopped driving. I gave it up because I couldn't see anymore. And it struck me that he didn't realize that he could undergo a very straightforward outpatient procedure to remove his cataracts, and he wouldn't have to give up driving. He wouldn't have to try to rush home after dinner to try to get home before the sun sets.
While Dr. Henderson says she can't promise cataract surgery will improve things like your golf game, she can promise better vision following cataract surgery. But some folks panic when they even think about eye surgery. Dr. Henderson says after they've gone through it, most patients say it's not traumatic at all.
It is an outpatient procedure and they are awake, but they usually have topical anesthesia or local anesthesia. And so during the procedure, the internal lens is removed, usually with ultrasound, sometimes with laser now, and a new artificial lens is placed in the eye. Oftentimes there are no stitches anymore and the recovery is very quick. So the next day, a lot of patients are right back to driving or playing golf or going for their walks, taking showers. It doesn't really hold them back very much. They shouldn't be afraid of the procedure. It's much easier and safer than it used to be a generation ago.
So if you think you have cataracts, what's your first step to taking care of them?
The first thing is to make sure that you have a good comprehensive eye exam by your eye care provider to make sure that there aren't other reasons why the vision is decreasing. So number one is a proper diagnosis of cataract. And number two is to really discuss the procedure and the risks associated because it is surgery. And then number three is to talk about all the different lens options. There are so many now. We can decrease astigmatism. And like I said, we can get rid of nearsightedness, farsightedness. We can now even get rid of presbyopia, which is the need for reading glasses. There's even another benefit now that for people who have glaucoma, they can actually have a procedure during the cataract surgery to decrease their pressure and maybe try to get off some of their topical glaucoma medications. So there are lots of things that the patients should discuss with their eye care provider.
You know, Dr. Henderson went on to say that while cataracts are a natural part of aging, they can actually develop because of a previous injury. So, for example, let's just say you were elbowed in the eye during a basketball game when you were younger. Well, that might be something you definitely want to mention to your eye doctor the next time you go in for an exam.